fastest, and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what health care agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome, South Florida and the rest of the world. Tonight, I'm very happy to fill in for David Pina, who's basically on a little vacation. And we have a great guest tonight. We have Dr. Nicholas Coretti III, and Dr. Nicholas Coretti, his specialty is foot and ankle surgery. Doc, tell us a little about you. What do you really do? What is foot and ankle surgery? They use the word foot and ankle surgery. Basically, what does it mean? What do you do with foot and ankle surgery?
Well, there is a lot of, well, first, thank you for having me on the show.
My pleasure.
There's a lot of opinions about what foot and ankle surgery is. To me, the foot and ankle surgery has to do with any kind of, difficulties, any pain, any discomfort, any kind of ailments that you have in the foot and ankle. And more importantly, not specifically with surgery, is a matter of, what can we do with that problem conservatively? What can we do with the problem conservatively to help? And right. And the point of it is that I like to try to address that there's more options out there than just a surgery for different conditions in the foot and ankle.
What are some of the reasons? What are some of the causes? Why would I go to a podiatrist?
Right. The podiatrist is very important for all the conditions in the foot, and the fact that the matter is that many people don't realize how many other problems you can maybe catch if you have good podiatry care. Diabetes being one main condition, but anytime you're feeling this, any kind of redness, pain, swelling, loss of hair in the foot, excessive sweating, many sports conditions, if you're a runner, if you're an athlete, it's good to have a good partner in a relation with a foot and ankle surgeon or a podiatrist to be examined. You don't want to, you want to try to catch things before they happen.
I'm a senior, and sometimes I feel that my feet are hurting, they're burning, and I always feel, I always thought foot and ankle, podiatry, what's podiatry? Cutting the nails or doing this? But as you go older, you realize how important your feet are. I mean, if I can't walk, right?
That's right.
My quality of life is gone.
They always say, you wish you knew a podiatrist when your foot starts to hurt, and that's the thing we have to try to change. We have to try to change that opinion. We have to try to be already aware and prevent these conditions from happening. Burning, tingling, and numbness in the feet can be a lot of problems, comorbidities such, like we were saying, diabetes, lower back problems, arthritis. There's so many conditions that can be making those symptoms feel more problematic. And they're treated differently. They're treated conservatively. They're treated surgically. And a good evaluation, good clinical evaluation would definitely help.
People go in for checkup with their whole body once a year, twice a year, but they never think of checking their feet until they hurt.
That's right.
So really, what you probably do is that you're getting that full checkup. Also, go see a podiatrist.
That's right, and we'd be happy to help and at least give you more awareness, actually, of the different conditions that maybe you can catch prior to having that major pain.
How could our listeners get a hold of you? I mean, you have a phone number? What is your phone number that they can call?
The phone number I have, I'm currently in Miami Shores. The phone number is 305 603-7650 within the MediStation Urgent Care. That's my office at this time. And I'd be happy to help with.
And if they call you, can you get them in, or can you get an appointment and give them the directions how to get there? Or?
Oh, of course. We have a friendly staff, and be willing to definitely see the need of the patient. The patient, sometimes we always ask a lot from the patient. I really like to bring the service to the patient and really cater to their need.
And that's the thing today, folks. In my experience, anyway, especially in home health, my experience today, people do not spend enough time. The physicians don't have enough time to spend with their patients. I know. I was just talking to Dr. Coretti, and his format is that he's going to spend as much time as he possibly can, if you have a problem, to explain that problem to you and how to correct it. Am I correct, Doctor?
That's you couldn't hit it any better than that. I really feel that we get rushed as physicians to pushed by so many different problems that we need to hurry up and see the next patient. I really want to try to change that attitude. I want to try to spend and really come down to back to what medicine used to be. Quality care.
You believe in that Hippocratic oath, don't you?
Oh, yeah, that's right. We took it for a reason.
And I think it's gone today with a lot of physicians. I'm not saying it is, but I know Dr. Coretti, after talking to him a while, he's educated pretty well. You're educated at Rutgers?
Yeah, I'm originally from South Jersey, South Philadelphia, and I went to Rutgers University. Then I did a master's at UMD&J. I got tired of the cold weather up there, so I moved down to Barry University and did my training. Then I did 3 more years at Westchester in Miami, and like you say, happy wife, happy life. So life has led me to be down here, which has been wonderful. And now
you have a little one now.
And now we have a 1.5-year-old. He's a wild man in the house. We're after him, and it's been a real blessing. Down
and he's got
South
great
Florida.
feet.
Oh yeah, he's got better than me. He's from the mother side, the better side. Yeah.
Tell me, what age do people really feel that they develop ankle problems or foot problems or feet problems? Because your specialty is below the knee. Am I correct?
That's correct. And it really comes down to what they're doing, the activities that they're doing. Obviously, someone that's more athletic or more training. You want to see maybe see someone more often. Someone that's maybe a little bit more elderly. Their activity. There's no reason why the elderly shouldn't be active. We should try and promote that. We should try to increase the cardiovascular. I really believe that. And what can we do to keep you walking? There's so many times that patients come to me and say, Doc, my primary wants me to walk, but I can't because my feet hurt. And I got to lower my cholesterol, and I got to lower this, and I have to do this. But I can't, and I want to. So I really want to try to fix that.
My problem right now. I want to, but I can't. So we're in the process of doing it. You can lose a lot of weight if you can walk, but if you can't walk and you sit in a chair all night, you're not going to lose too much weight after you eat a bowl of spaghetti or something like that.
That's right.
So you're not going to lose too much weight, right, Doc?
That's right. So we have to try to change that. We have to try to work. We have to cater to the patient's need of what they like to do, what activities do they like to do, and try
that's
and facilitate
important.
that.
That's important because quality of life. Let me tell you, from the feet up, if your feet hurt you or your knees hurt you, listen, your quality of life is terrible. It's just because when you're hard to get out of your chair, it's hard to get out of a car, it's hard to put that foot on the ground when you get up in the morning. And Dr. Coretti, as I said, is a foot and ankle specialist. Again, that phone number is, Doc, can I have it again?
Oh, of course. 305-603-7650.
And right now, Dr. Coretti is seeing about 30 to 40 patients a day. As you can see, he's quite busy. And he's busy for a reason, because he gives good care. And the whole thing about care today is you got to spend some time with the patient. And a lot of seniors really not getting that care today that they should be getting. And that's why we have this show on called You and Your Doctor Live Longer and Healthier. And we're so happy to have Dr. Coretti on. He's down there in Miami. And if you're anywhere near Hollywood or Florida, he'll come up to you. He can even come to your home. He'll service you at your home. He's available by just giving him that call at the number you got at the bottom of your screen, as you can see. If you're watching it on via a website, you can get his phone number and you call him. It's Dr. Nicholas Coretti, Coretti III, foot and ankle surgeon podiatrist in Miami. And Doc, what about, podiatrists see a lot of people with, I think, diabetes, create a lot of wounds.
Oh, yes.
Diabetes causes a lot of wounds.
Diabetes, yes, in a sense. Diabetes is always one of our main problems down here and everywhere, I should say. But diabetes alone, we need to try to educate the patients more about how important it is to get their feet checked. Every 2 to 3 months we always try to say, but I would say, if you're a diabetic, you've never seen a podiatrist, it would definitely benefit you to just go in for a checkup.
Right.
And the bottom line is what else can we say about it? Well, the pressure points in the foot, the calluses that develop, the trying to prevent the wounds, the arterial circulation, the venous circulation, the nerves. There's so many conditions just in the foot from diabetes. The muscle atrophy that we really need to try to get a handle on, and it's difficult. Sometimes it's very difficult.
Well, I have a friend of mine, Doc, and you can probably understand this. He was a podiatrist, too. And he didn't watch his diet. He got diabetes. And next thing I know, he's already lost 5 toes to amputation.
Right.
What would cause a person to lose toes if he has diabetes? Is circulation? What would it be?
Right. So the big thing that I see personally, circulation is a big problem in this type of factor, but also infection. We want to try to prevent infection. And wear and tear of the toes, these calluses build up. You don't realize that you're maybe stepping on something, either glass or some kind of metal. I mean, I've taken pieces of metal out of patients' feet that don't even know it's there. So the bottom line is that are we optimizing these patients cardiovascularly in the lower extremity? Do they one toe? We always say one toe leads to a second toe. Why is that? Because now we're distributing the pressure. When we remove one toe, that pressure goes from one to the next one. Why is that? Well, because now we're shifting while we're walking, we're shifting our weight more. Is the patient optimized? We need to get a good, what's called a limb salvage team together, a vascular group, endocrinology. It's never just one person. It's a collaboration of people to try to save the limb. And that's what is very, very important, specifically with diabetes and your friend.
Mm-hmm. So the fact is, this could happen at any age?
Yeah, of course. I mean, it's a matter of of how well they're taking care of themselves. Are they following up with their primaries? Are they controlling their sugar? Are they eating right? Are they getting good diabetic shoes? Are they getting offloaded? There's so many factors to really search and to investigate as to why. And it starts with the very simple thing of coming into the office and getting that fear out of your mind that you can overcome this, because you can.
If I'm a parent and I have young children, what are some of the symptoms of the younger children? Not young, but say kids in high school are playing sports, and sometimes they complain about their feet, and they could have basically a foot and ankle problem, but they can be walking around with it for how long?
That's right. There's a lot of times we get the younger children with flat feet conditions, different growing problems in the bones that can cause pain. These we can evaluate maybe radiographically by the clinical evaluation. We try to get them into some kind of supportive shoe, sometimes bracing, depending on the patient's condition, depending on the child's activity. Or is it all the time? Is it only during certain parts of the day? Is it when they're only doing their activity, or is it at night? So the problem, the biggest thing is to really understand why, and understand what is causing all of these conditions.
At what age would you take a patient? What age, say early age, what age would you look at a patient? Some people like to go to pediatrics, but you're at 16, 15, 18?
Oh, yeah, no, I've seen them all from 5 years up all the way up to older in the 90s. I mean, it's some I get some mothers or fathers come in with their child and say, oh, what's going on? My kid's gait, my kid's walking is differently. It's hurting them. I mean, is there something that we should evaluate early on? And the answer is yes. We should at least get an evaluation. We should get something at least if we can correct it early. If for children, we should correct it earlier. But how much should we do? And that comes from just coming in and evaluation.
So listen, you folks out there that have grandchildren, and if you see that have foot problems or feet problems, you want to talk to Dr. Coretti. Because, sometimes the parents don't see it, but maybe you as a grandparent out with the kids one day and you'll see he has a foot problem. You want to get a hold of a foot and ankle guy. You want to get a hold of a Dr. Coretti, who specializes basically in this type of service. Now, everybody worries about their heart, and they worry about their knees, and they worry about their brain with dementia. Guess what? The last thing they think about is their feet.
That's right.
So if you can't walk, I can tell you right now, you don't have any quality of life. So the question is, you also do other services too besides foot and ankle. Now, gentleman needs. Sometimes I've been talking about ankle replacement. Something new I heard. Ankle replacement. What's an ankle replacement?
Well, ankle replacement is a type of procedure. It's a surgical procedure to.
Is that like a knee replacement?
It's like a knee. Like a knee replacement. We do them in the ankle joints. Patients that usually have some kind of destructive arthritis conditions in the foot. We do it in the feet as well. Replace the joints. These, the cartilage wears down over time. The joints wear out. What can we do to kind of give you that range of motion back, give you that feeling back, give you that walking and that comfort back? Ankle replacement is something that, we kind of look at as an end stage type of thing. We try to manage, the problem, conservatively as much as we can, of course. Through a series of different injections and, PRP, stem cells. These are all kind of newer products that have been out now that try to keep people from surgery that maybe don't want to go through a major procedure. But total ankle replacement has definitely, improved in the last 5 years, at least 8 years that I've seen, with the different types of joint replacements and the bearings that they use in these type of procedures.
It's amazing. You talked about PRP and you talked about stem cell. You being a young man like you are, and you graduated, a few years back, you're really up to date with all these new procedures. Where, I'm not saying an older doctor, you're coming up, about the robotics, and a lot of medicine today is going technical. Mm-hmm. With high tech stuff, with stuff like robotics and etc. You do any robotic surgery?
Well, I personally don't, but I have collaborated with other doctors that do. They're able to take a wire and go all the way down to the toe for maybe a vascular condition. And it's amazing to see that can be done now. It's amazing to see that these different, I'm not sure of the exact name of the Da Vinci robotic type of surgeries are being more investigated with the lower extremity. It's wonderful. It's wonderful. Yeah. I would love to be a part. I would love to be a part of that. To be honest with you, more. I personally haven't used robotics, but I do know physicians that do.
Okay, and with PRP, you said PRP. What type of treatment is PRP?
So platelet-rich plasma is more and more of a common ailment now, or therapy, I should say. They usually take your own blood, they spin it down, and they use that plasma, which has different types of growth factors and peptides in your own blood that help with regenerating tissue, help with pain, help with arthritis, help with any kind of trauma, post-op, pre-op. There's so many factors that they've found in your own blood that they can isolate and really help you with different conditions.
Doc, this is so interesting, but they're yelling at me to get a commercial break in here.
Okay.
Can we get a commercial break in here? Possibly get a commercial break?
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, listeners. We have Dr. Nicholas Coretti, a foot and ankle specialist, a podiatrist out of Miami. His phone number is 305-603-7650. Let me give you that number again. It's 305-603-7650. If you're having any kind of pain in your feet, up to your knees, you want to talk to Dr. Coretti. He's with us tonight, so we're going to ask Doc a few more questions and see. And if you have any questions, feel free to call in. I know he'll be happy to answer, or you can reach him again at 305-603-7650. So, Dr. Coretti, as far as foot and ankle surgery, we spoke about ankle replacement.
Yes.
You said about shoes. If you have basically, I always look at people's shoes. People always say, what nice shoes you got. Now, people with diabetics, they're allowed to get a couple of pair of these diabetic shoes, aren't they?
That's right. The insurance is now allowed Medicare. Perfect. Yep. And it's one pair of shoes with 3 pairs of the inserts. For diabetics, we usually recommend what's called a plastisol insert. It's helped with the shear forces and the reducing the callus and the buildup in the foot. So the idea is that you would have the one pair of shoe and then replace the insert. I say, well, the technical term is every 200 to 300 miles, but no one really knows how many miles so I say every 2 to 3 months, take those out, put some new ones in, see how they feel. They usually feel a lot better.
That's great. Now, I understand you're also doing some wound care.
Oh, yeah.
You specialize in wound care?
I'm board certified in wound care, yes.
Well, that's fantastic.
And I see the need. I see the where things are going. I want to be a part of saving the limbs. I want to save every toe. And I feel that it's so important to be grossly involved. If you're going to do diabetes, you're going to do limb salvage, we need to go into some kind of wound care system. That's what I think.
And also, I'm a 80-year-old person, and I got diabetes. And, the factor is that I try to cut my toenails, but I can't. And I know if I cut it too deep, my mom was that problem. I had a mom who was 81 years old. She was a little heavy. She couldn't get down to cut her toes. And she'd say, I got to go to a podiatrist to cut my toes. Now, you'll even do that, right? You have that, too?
I'd be happy to do everything. I don't have one per se. I only do this. I love podiatry. I love the field I work in. I would love my job is to service the health of others. And, I'd be happy to cut the nails, to do a bunion surgery, to fix an ankle fracture. And the bottom line is that, and no job is too small.
So, Doc, they just tell us we got 2 minutes left.
Okay.
Tell me what you want to tell me about where to get a hold of you, how to get a hold of you, what your basically specialty is, and that the caring that you're going to give to our patients that are come and see you.
Okay, wonderful. First, thank you so much again for having me on the show.
Oh, it's our pleasure.
To everybody. This is what I like to call is Toe Time by Dr. Coretti, the 9600 Northeast 2nd Ave, Miami Shores, Florida, 33138. And the phone number, once again, is 305-603-7650. You can also reach me on my email, njcfootandankle.com.
njcfootandankle.com. And the number again is 305-603-7650. Have I got any more time left? I got 1 minute, they tell me. Okay, now I got 1 minute, Doc. We got 1 minute to do this. So the factor is that he will treat you. And I promise you one thing. After meeting this young man and talking to him, I know one thing. His first thing is patient care. He's not looking, and he takes insurances. I believe he takes a number of insurances. He takes Blue Cross, Aetna,
Cigna, Medicare,
Blue Cross?
Medicare, yep. And we're working on more of them, more and more. Yeah.
Okay, so
Yep.
he'll take most insurances, and believe me, if you don't have the money and you need care, he'll take care of you.
That's
Come
right.
and see him. He's a doctor's doctor. When doctors have problem with their feet, who do they go to? But Nick Coretti.
Wonderful. Thank you so much.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.